Hi, I am Dr. Wei Jin and he is Dr. Zhen-Hao. We are from Guangdong 2nd Provincial General Hospital of China. In here, we would like to introduce our study focusing on the anatomic pathways between internal and external carotid artery branches in the upper face, which is ICA and ECA branches in the upper face.
In the study, we clarify the origin, frequency, depth, distance, and pathway of forehead and temporal arteries by computed tomographic angiographic scanning of non-emboled head. In brief, in 57.9% only one connection, in 31.6% two connections, in 5.3% three connections, and in 2.6% 4 and 5 connections, each between ICA and ECA territories were identified. A superficial connection was observed in 15.8%, whereas in 84.2%, the anastomotic connection was identified to be both superficial and deep.
And for the location of the anatomic connections, in 84.2%, the connection was identified medial to the temporal crest or the lateral orbital rim, while in 15.8%, the connection was identified lateral to the temporal crest or the lateral orbital rim. The connection pathways between ICA and ECA vascular territories in the upper face was highly variable and was influenced by the layer of the ICA vessels. The superficial branches connection most frequently, about 60.5%, to the transverse facial artery, and the deep ICA branches connection most frequently to the frontal branch of the superficial temporal artery in about 44.7% of the head face.
Using the suited injection technique of the targeted facial region, selecting the safer needle, cannula, injecting at a slow injection speed, administering small amounts of product, and performing pre-injection aspiration are all accepted ways to increase safety during the filler injections. Well-established and evidence-based supported technique should be followed when treating the temporal, forehead, or the peri-orbital region.
Based on the vascular connection discoveries of this study, with further anatomic investigations and data analysis, we believe we would propose a safety-improved filler injection method in the forehead and temporal region in further study. Thank you for your time.